Time now for Morning Rounds, our look at the medical news of the week. According to the American Heart Association, every 40 seconds, someone in the U.S. suffers a heart attack. That is a disturbing number. But a recent report shows that for older Americans, those numbers are actually going down.
The study analyzed over 4.3 million Medicare Fee-For-Service beneficiaries aged 65 and older during a 19-year period from 1995 to 2014, looking at the patterns of hospitalizations, treatments, and outcomes for heart attack patients. Here to discuss the findings and more is CBS News medical contributor Dr. David Agus. David, good morning.
Good morning to you.
So what did we learn here?
This is pretty important data. It shows over a period of 20 years, 2 decades, the rate of heart attacks, hospitalizations, how people did at the hospitalizations, the length of them, and how many people died went down dramatically, almost a third across the board. So we had the same treatments in general 20 years ago. We're using them better, we're using them quicker and more appropriately now. This is big progress.
Is it really just devoted to those changes? I mean, in terms of improvements?
Oh, no question about it. Is that we have these algorithms of what to do, and we're implementing them very quickly. The quicker you act, the more you can get blood supply back to the heart. When we actually tell people the right things to do after a heart attack to prevent another one, you get a better outcome. And the system is working better now, and we're seeing it in the data.
How can they be sure it's the system and not people living healthier lives?
I think living a healthy life is part of it. We're certainly smoking less as a nation over the last 2 decades. But when you look at the numbers of the heart attacks and the outcomes of the heart attacks, they're getting better. And that's the system.
Doctor, would you say that means we can, as 65-year-old Americans, drink, smoke, and eat red meat more?
100%. I mean, this is
really?
a
I did
free
not expect you to say
do
that.
whatever you want. No, if it ain't broke, don't fix it. What we're doing now is working. We got to keep with it.
And how about that baby aspirin?
Baby aspirin a day has a dramatic effect. Oh, come on. Cancer, heart disease, stroke. I know you're pushing me here, but I believe in it. The data are what the data are.
Okay. All right. We've long been told of the importance of mammograms and breast cancer screenings, but now some changes are on the way. The Food and Drug Administration has announced that for the first time in 20 years, the agency will propose new protocols to empower patients and improve the quality of mammogram services. David, this is the second leading cause of death among women in America, right? So what exactly is the FDA proposing?
So this is the first time in 2 decades that they're saying, hey, we're regulating mammography, mammogram centers. We want to make it better. So the first thing, which I think is critical, is about 40% of women over the age of 40 have dense breasts. Dense breasts means you're slightly higher risk for breast cancer. And sometimes it's harder for mammograms because the denseness makes the mammograms white. They can't see the cancer in it. And they're saying you have to report it to the patient what's going on. That's powerful. So that doctors can read it and just, write something, they now have to explain it to the patient so they will know their own risk.
Having been through this, more so than either of my 2 young men here.
More so, David.
More so.
But the question is it at all dangerous the number of times you have mammograms?
So mammograms are radiation. So it's putting energy through your breast. So there's no question there is the small finite risk to getting a mammogram. But when we look at the data, catching breast cancer early saves lives. The key to the FDA here is they're regulating quality. So the quality of the center. If the center is not good, either the center or the FDA will write you a letter saying, hey, this center wasn't good enough. You need to get tests elsewhere. And now actually telling the patient exactly what's going on so they can maybe get another test, an ultrasound or MRI if needed.
More than 1 in 10 women in their lifetimes are likely to have a cancer diagnosis for breast cancer. What can be done to bring that number down on the front end, ahead of the diagnosis?
Well, I mean, it's prevention, right? It's being lean body mass. It's knowing your risk. It's, if you need to, take some medications that can actually lower a risk. But more than anything, it's screening here. Screening is critical to catch it early and save lives.
All right. Dr. David Agus, thank you so much for being with us this morning.
Thank you all.
A lot of good news in there, actually.